All right, here we go. So, hey, Dr. Ian here, Dr. Autoimmune. You know, uh, always open to suggestions on what we do for lives, but one of these things that repetitively is coming up over and over again is that's right, Libby, you made it. I get this chronic direct message from people about saying essentially, hey, I got the vaccine. I started developing symptoms, or I had COVID. I started developing symptoms. So what do I do? Because probably the most common thing that people are saying is smell. Next to that is typically brain fog, and then there's usually fatigue issues going on with that. So, again, the question is one, what's happening with your body, with your brain, and then obviously your system. And then what does this mean now that we've actually had alteration in smell, brain fog, fatigue, vascular changes, rashes, whole host of different symptoms that are coming up. So again, what does it mean to be long haul? What is that term? What are they kind of diagnosing this as? What is this issue? And then what can we start to do to actually look to say, hey, what is the root cause behind long haul? So again, my name is Dr. Ian. I've been practicing functional medicine for 15 years and essentially trying to figure out what is the root cause and the reason why people have chronic issues. So basically, again, if we're dealing with long haul, we know that we had, again, some form of COVID infection. Again, it is also possible, and this is something that's coming up, is that people said, I'm no longer the same after they got the jab. And then spike protein is spike protein. Your immune system does not really differentiate between an infection and also a immunization. And we know, unfortunately, and we've seen that in the research, that immunizations do also lead to autoimmunity. It's debatable, and they haven't really done the research to look at which one is worse. They're not really tracking that right now. So I'm not gonna really kind of turn it into a debate on that. But the most important thing is that if you've had smell changes, then that's impacting a specific area in your brain, right? That's called the hippocampus. So hippocampus is in your temporal lobe. That's where we have sensory processing. And so when we essentially, right, have changes in smell, it means we have changes in our brain. And changes in our brain come from very specific reasons. But if this has been going on for longer than 3 months, meaning actually we've seen inability to notice smells, if you've seen, hey, I don't really seem to be bothered by garbage and people in my family are being bothered by garbage, or, oh, I didn't really realize that was a lavender, bubble bath. When you start to see that, wow, there actually is, or again, we have parosmia, and which means essentially you'll start smelling abnormal smells, is another indication that there's been a perception change in your temporal lobes, right? No, so the changes in the brain aren't going to show on the MRI because they're inflammatory based. And that inflammation is again going to be connected, right, to very explicit issues that are again not necessarily being addressed from a primary care or even a neurology perspective. So again, just to understand that the reason why there's issues now is that there was inflammation going into COVID, typically for most people. You lost control of the inflammation, and then that turned into autoimmune. Okay, so again, I'm just kind of setting up this whole talk because you have to kind of understand like where we're coming from to know where we're going. But if we had COVID, we had smell changes, those didn't resolve within 3 months. We know that the hippocampus is involved. That's where we're getting processing of sensory information. This is a big deal because if we're walking into rooms and we're forgetting why, if we have memory loss and we have smell loss, smell right now is a primary predictor for cognitive decline, right? So for actually hitting cognitive impairment, one of those indications of dementia is the change in sensory perception, especially smell, because smell centers are also memory centers. So this is why, I'm gonna actually raise this up. This is why this is so big, and this is why this is turning into be a bigger problem, is that people don't realize that it's not just a smell problem. Your smell is a brain problem, and your brain problem becomes a life problem. And so again, from a provider perspective, it's hey, what's the underlying root causes? Okay. Britt Ann, hey, you got hives, right, for getting COVID. Again, that's going to relate to probably vascular changes, and we'll talk about that. But again, the bigger issue is, what are the root cause issues that are still going to be present, you guys? These are still going to be here. It's not like those just went away. The issues that cause the smell problems, or the memory loss, or the brain fog, or the fatigue, or the rashes, they're still there. Okay? America, go away. Viagra. Oh boy. Okay. Look at that. I can have community flagging now of comments. Oh my gosh. So let's talk about it. Let's talk about those. Well, let me just ask this. Do you guys want to hear what those root causes are? What the research is being reported? Because again, COVID, it's causing smell changes, right? Well, the bigger issue that we're seeing right now is that we're actually seeing changes in that blood-brain barrier. So there's a capillary network, right, of cells that literally go around your entire cortex. And if you breach a barrier, it sounds awfully familiar to this thing called leaky gut. So now, again, you can have leaky gut and leaky brain, but it literally can start as an inflammatory issue that's primarily impacting your central nervous system, and then that's where the autoimmunity starts. But for most people, it is going to involve gut changes, okay? So let's talk about about again, things that are probably driving it, tests that you guys need to run, right? Find the providers to do that. I'm 100% online. This is what I do. But you can also potentially find people that might be able to run some of these tests if you can convince them to do it. But it's also interpreting it and knowing what to change, because that's ultimately what's going to improve your guys' health. Is, the brain fog is not going to go away by taking aspirin, right, or ibuprofen. It's not going to go away because of an anti-inflammatory. It's going to go away because the trigger is removed that's causing the inflammation. That's much more relevant than just saying, well, I'm going to take some turmeric, and I'm going to take some CoQ10, I'll take a natural anti-inflammatory. It doesn't work. I've been there. I've done it. Yeah, you got it. EBV, that's one of our issues. So again, remember, long haul, typically with new symptoms, you're going to see waxing and waning. You're going to see up and down with those symptoms. To really be considered long haul, it's over 3 months that you've been dealing with these issues. And now our concern is that we have a leaky blood-brain barrier, and we're now actually dealing with an autoimmune mechanism. So this is, again, I've never done this lecture before, just so you guys know. This is the first time I've ever done this lecture. But there's a lot of research that's coming out. And there's a lot of debate about what's really going on here, but there's some things that are very clear as far as what those triggers were, and then understanding the mechanisms behind those triggers, and again, removing the lifestyle impact, understanding the dietary things that you need to do, right? Understanding what supplementation to use. That's the stuff that will start to change your life, okay? So here, so again, what's really important is that we don't let people tell you it's normal to have smell changes after COVID, especially again, if it doesn't go away, smell and taste, brain fog, fatigue. It is not normal to have those issues if it's been longer than 3 months. The longer that goes, the more likely, again, that there's an autoimmune related issue. And what's the biggest concern to me, the volume of people that have said, hey, look, I'm not right, I'm not well, and what that implies as far as for your future neurologic health. Again, as of right now, there are no tests that are definitive for dementia and Alzheimer's. It's a retrospective diagnosis. It's saying, hey, look, you have this criteria, almost like a syndrome. And if you have enough of those issues on the diagnostic criteria, they give you the magical jersey and say you now have Alzheimer's. But Aricept, the #1 medication, terrible side effects, and it doesn't really do much for people. So the best thing we can do is look and say, hey, preventatively, what can we do to start to get that process turned around that's pushing your brain towards what we call neurodegeneration? Because that's really what we're talking about here, is the manifestation of neurodegeneration. So when one cell, so if this is a neuron, okay, one neuron is connected to another neuron, which is connected to, right, 3 other neurons, which are then connected to 3 other, right? And then you can see what happens is that we have a whole network of neurons. And so there is a process that is called the excitotoxic model of neuronal degeneration, meaning when you lose one of these neurons, you're not just losing that neuron, you're impacting all of these pathways and then downhill. This is why it speeds up over time. This is why dementia is going to show up more intense and severe in the later stages of it, because you're getting inflammatory changes and these neurons are all connected to other neurons, which is part of them being healthy. You have to be connected. Neurons need 3 things, okay? Right? So as a neuron, 1, you need excitation. You need to use your brain, okay? 2, what we also call it stimulation. 2, oxygen. You need blood flow. 3, glucose. So any one thing that's basically interfering with that, if you interfere and someone has a stroke and you can't stimulate those pathways, those neurons are going to become more vulnerable and you're going to get die-off of those neurons. Okay? If you have anemia or if you have inability to get blood flow into tissues, that's going to kill off neurons. If you don't have stable blood sugar, i.e. this is the #1 reason why people go on and develop dementia in this country, is because of insulin resistance in the brain. We call it type 3 diabetes. Type 3 diabetes, it's real, but again, there's no test that your doctor is running that's saying, hey, you've got type 3 diabetes, we caught it early, and you're not going to actually now go and develop dementia. So what's more appropriate is that we actually test and assess via smell. Smell is the #1 documented test that your doctor can do in office. You can do it at your house, okay? And you can assess, and again, this is where it's important to be blinded. You can't be the one that's testing yourself. Okay, guys? It doesn't work like that. But I'm going to give you some oils of what you can use. So your husband, your friend, the guy down the street, maybe not the guy down the street, but someone should test your smell and see if you can, just 2 things when you test smell. How soon do you detect it? And then, meaning, how close does it need to be to your nose to you to detect it, okay? It needs to be unilateral, meaning we do one side at a time, because your right nostril goes to your right hippocampus and your left nostril goes to your left hippocampus, different hemispheres of the brain. That's a principle of neurology. Ipsilateral firing from the nostril to that side of the brain. Okay? So what's important is that, again, I usually test. So as far as I'll get oils, let's just use a different color. So for testing, okay, there is peanut butter. Okay, that's one. Literally peer-reviewed research done on peanut butter. It's called the peanut butter test. Okay, people are like, this guy's crazy. He's testing peanut butter. I'm like, yeah, it's in the research, but it's a peanut butter test. Okay. Okay. Two. So pretty little extras. You're talking about parosmia. Your smell has changed. That is also relevant. That is also an indication of long haul if it's been going on for longer than 3 months. If you've been having sensory perception changes longer than 3 months after a COVID infection, more than likely, again, that is autoimmune. So again, we're talking about, hey, how do we know how bad our smell is? But then I'm going to get here quickly into what are the root causes, what are the mechanisms that are causing neurologic inflammation, and what can you guys do differently than what you're doing right now, okay? So that we can start to, literally, you can reverse neurologic inflammation. You can't make neurons come back. They're dead. When they're dead, okay? But you, fortunately, have a huge volume of neurons. This is also why people, they have strokes and they can learn how to write again. They can learn how to speak again. There may be limitations for them, but it is pretty amazing through neuroplasticity what your brain can do. And yes, there are some supplementation. There's things out there like brain-derived neurotrophic factor, BDNF, and there's some supplements and there's some cool things that we can start to incorporate that are, again, anti-inflammatory. But what's, again, what I'm going to talk to you guys about is even more important than BDNF. It is more important than taking lion's mane. It is the things that are, again, causing the damage to the central nervous system, because if you don't remove that stuff, you're screwed. You're still going to move down that path, and that's not a path that you're going to want to go down. Okay? So again, peanut butter can be used as an assessment. It's fairly accurate. I just tell people get a new container, a new jar, so it's fresh, right? So there's going to be coffee, peppermint. Okay, so those are probably the top 3, right? And then 4, I usually also grab a citrus oil. So like an orange oil or a lemon oil like that. But those would be probably the 4 most accurate things that I've found. Like don't grab a lavender or something like that. But again, what's important, the reason why I recommend people to test for this, one, they may not know that they have a deficit going on. You're actually showing potentially your spouse that, wow, your smell is really changed. This is, I'm not like, again, I'm not somatizing here. I'm not trying to make up symptoms here. This is a real problem that's going on. And then as well, it's important to come back and repeat that testing to see if you've made progress. Always, again, test, don't guess. Test, don't guess. Figure out objectively by repeating that test, maybe in about 6 weeks to 8 weeks, if what you're doing from a protocol, right, is making a significant difference for your brain. Because your smell will start to change as a result of that. Okay? Your fatigue should start to change. Your brain fog should start to go away. In fact, all of those things should actually start to happen simultaneously, right, as you're seeing a reduction in neurologic inflammation. The crazy thing is, guys, is that, guess what? Your brain and your gut and your brain are intimately linked. So when we start talking about, again, like what's kind of this like typical scenario that people find themselves in going through, again, a COVID infection or having gotten the vaccine, and then all of a sudden everything changed. Like what were the predisposing factors that led to that neurologic inflammation? Yeah, Chris, balance issues are very common. Okay? So, by the way, I tell my long haulers that we usually should have their symptoms typically resolve within 3 to 4 months. That's kind of typical for us. Usually within 30 days, people are seeing significant progress. But again, that's because we're testing, we're not guessing, and we're basing their protocols based off their biochemistry and their history and exactly what they should be doing. Okay? So C-reactive protein, JM, doesn't necessarily measure neurologic inflammation. but it can be influenced from neurologic inflammation. So CRP is interleukin-1, interleukin-6, and TNF alpha. It's 3 different chemicals, and it's stimulated through the production of something called toll-like receptors. So any mucosal surface is going to have a high percentage of toll-like receptors. So one of the common findings as well, right, of long haul is that they saw an increase typically in their HS-CRP. Just because I'm curious, so anybody else out there that, again, had a COVID infection or had some kind of an upper respiratory tract infection, and all of a sudden they saw an increase in their HS-CRP on their labs? I'd just be curious to see if anybody else there is actually dealing with that. Cartel funds, neither. Way too smart for that. Okay? Yes. Okay, so again, that's typically what I get. All right? So again, what's going on, remember, this is reflecting mucosal surfaces. Okay? So if we saw an increase in your C-reactive protein, again, toll-like receptors, which are found most predominantly in your gut, gastrointestinal tract, have the highest concentration of toll-like receptors. Okay? And toll-like receptors, they trigger, again, interleukin-1, interleukin-6, TNF alpha. Those are the actual chemical messengers that are responsible for the production of CRP. That's in your liver. That's also in your heart too, but that's why we also check HS-CRP versus regular CRP. So the point of this is that, again, if you've been told, you suspect that there's long haul, if there's an increase in C-reactive protein as a result of it, that is a red flag. Because now we're talking about, a mucosal surface, and yes, your upper respiratory tract, okay, is involved, but the area where we see the most toll-like receptor activity, again, is going to be gastrointestinal tract. So my question for you is, if you have long haul, or if you suspect you have long haul, why aren't you looking at your gut? Good. And so here's the deal. So like someone's saying, hey, right here, they haven't been smelling for 3 years. Guys, here's the deal. If neurons, right, when they're not fired, they become unhealthy. Neurons need 3 things: glucose, oxygen, and stimulation. If they're not stimulated, if you don't use them, you know that old phrase, if you don't use it, you lose it. It is unacceptable if you have lost your smell. That is, again, an indication of neurologic inflammation. Those pathways are not being fired correctly, and most likely the reason of why this happened is still present. So I need you guys to hang with me, because we're going to talk about a therapy at the end that helps people regain their smell, but I don't advocate that therapy unless you're ready, meaning you've gone after the actual root cause mechanisms that are, again, causing the inflammation in the first place. Okay? SG, been drinking turmeric and ginger every day, fantastic, love it. Great anti-inflammatories. Okay? Boswellia, frankincense, turmeric, ginger, quercetin, right? I'm all about anti-inflammatories. However, again, anti-inflammatories are fairly non-specific. So again, what I would recommend is you start to actually assess via testing and start to figure out, well, like where are we pointing? Where's the direction? Like, where is this really coming from? Okay? Lindsay, right there with you. Diet for me is huge too. So again, for those people that have had elevations of inflammation after these infections, especially when it relates to C-reactive protein, it is directly implicating your gastrointestinal tract. And so again, when we talk about, well, what really flares up the gastrointestinal tract, the number one, okay, is going to be this thing called dysbiosis. So the way that your body actually regulates inflammation is the balance of negative and positive bacterial influences on mucosal surfaces. So again, dysbiosis essentially just means there's an imbalance in negative bacteria, we call it opportunistic, and non-opportunistic or beneficial, we call that commensal. So these commensals versus overgrowth bacteria, they become imbalanced, and when you get a imbalance in a high level of opportunistic, dysbiotic bacteria, you start to lose control of regulating inflammation because you're de-emphasizing the good guys and you're increasing the bad guys. Okay? So yes, there is a link between long haul and low ferritin because if you guys, so in a menstruating female, their ferritin should be above a 50. Same thing in guys, okay? We shouldn't be above a 250 in guys. We should not be above a 150 in females. But the lower your ferritin level, the higher that correlates with malabsorption. The number one thing that causes malabsorption, again, is dysbiosis. And some people will call it SIBO, small intestinal bacterial overgrowth. But there was a peer-reviewed meta-analysis done that showed the people with the worst outcomes, i.e. the highest mortality rate, was associated with the lowest diversity of beneficial bacteria in the gut. Whoops. Again, what I'm trying to say is that if you're dealing with long haul, if you're dealing with chronic inflammation, there's gonna be a mucosal barrier component. Leaky gut and leaky blood-brain barrier are intimately linked. So if we're dealing with brain fog, if we're dealing with chronic fatigue, and yes, of course, as well, if we're dealing with smell-related changes, it's a neurologic manifestation, but very commonly, again, it started somewhere else. The inflammation is being regulated somewhere else, i.e. the gastrointestinal tract, but you've lost control of that. So Foxy Aussie Lady says, hey, what can we do? Well, you have control of certain things. One, your diet. You're going to have to start to build the beneficial bacteria in your gut, and you're going to have to de-emphasize the negative ones. Now, some people need antimicrobials. Some people don't. But for me, right? So as far as actually action steps, okay, 1, diet. 2 is going to be testing, right? Because, I mean, personally, I want to know, and this is through stool testing, is, hey, like, what is actually going on in the gut? Are you absorbing? Do you have carbohydrate digestive enzymes? Are you breaking your fats down? Do you have beneficial bacteria? There's a lot of complexity to what's going on in the gut. And here's the thing, anyone can benefit from prebiotics and probiotics, but it gets a little bit trickier when you start to say, like, should everybody go on oregano oil? Should everybody get this? Should everybody get antivirals? That's where it gets a little bit confusing because then you're kind of rolling the dice and you're not, I'm not going to be as confident that that's going to make a difference. Now, again, if you do a protocol and you come back and go, wow, I made a huge difference. Well, of course, you can say, okay, I'm confirming kind of that diagnosis retrospectively. So again, Kristen, again, the number one best way to tackle SIBO is not consume the foods that are driving it, which are going to be grains in general, right? Not just wheat, but all grains. And then it's going to be actually, again, building up the beneficial flora in the gut. And it's also looking to see what other hormonal mechanisms are present. So we haven't talked a lot about some of the hormone mechanisms that, again, are driving long haul, but I'll go through that now. But again, what I can tell you definitively is that those people that are dealing with long haul and especially smell-related changes is that I'm finding a huge number of them have gut changes. And again, indirect, so actually directly through physical connections via your vagus nerve and indirectly through obviously your circulation, your gut influences your brain and then your brain influences your gut. Okay? You can use colostrum. I actually do use colostrum for SIBO protocols as well. So yeah, I think colostrum actually is a good product. And it kind of depends on the case, but it doesn't always work that great with like methane-based SIBO. But for hydrogen-based SIBO, I think colostrum is fantastic. Okay, so again, as far as these mechanisms, right? So we'll talk say about root cause. So number one, okay, is going to be gut dysbiosis. Okay. Number two, again, is going to be Epstein-Barr virus reactivation. We also call it mononucleosis if you actually have the physical signs of mononucleosis. But again, Epstein-Barr virus reactivation does not just occur. It's typically associated with cortisol. So, I mean, there was no stress going on during the COVID years, right? Yeah, like they forced us into boxes and they said, well, you can't work, and here's some free money. And like everything is like upside down. And you can't hang out with your family. You can't hang out with your friends. So shingles is a form of a herpetic infection there, right? So again, when we have elevated cortisol, it can cause immune suppression, but chronically low levels of cortisol are associated with chronic viral infections. Okay? So this is also why, typically, again, you want to test, but we want to know the circadian rhythm. Okay? Because here's the thing, again, cortisol, okay, when you first wake up in the morning, you have a cortisol activation response, meaning it's a neurologic mechanism that starts to increase your cortisol over 100%. It doubles and sometimes quadruples your level of cortisol. That's a normal response if it's working correctly. So that's going to actually look moderately low, and then what's going to happen, it's going to spike up, and then it's going to come down, and then around noon, 1, 2 o'clock, it's going to actually be at its lowest. Okay? And then it's going to slowly creep back up in the PM. That's if your cortisol is normal. So if we don't have that normal spike, we don't have that normal like, hey, oh, wow, I woke up. Like, hey, I'm ready to go. Again, that's an indication that we've got a cortisol problem. If you're seeing a big dip in energy in the afternoon, again, another indication that we've got a problem with cortisol. Or if you're a night owl, well, I'm just a night owl. I'm like, no, your cortisol's off. There's no such thing as night owls, folks. That's not what happens. Your cortisol's jacked. Okay? So the point is that understanding what your rhythm of cortisol is can help you identify how you tackle that and how you improve it. Nanner says, well, what can we do? First of all, again, test your cortisol. Test, don't guess. I use the Dutch test. Okay? Because, for example, the other reason that I do the dried urine test for comprehensive hormones would be to look and see if you have estrogen dominance. Estrogen dominance is a common factor that causes gut dysbiosis because bacteria actually utilize extra estrogen to replicate themselves. So if we have estrogen dominance and we have gut dysbiosis, again, that is a recipe for disaster as far as for your brain health. And you'll know because your brain changes as you go into and leading up to menstruation. Okay? So the point, right, is what's related. Because yes, you can take zinc, you can take selenium, you can take, lots of antivirals, N-acetylcysteine, vitamin D, right? I haven't talked about that, but we'll talk about vitamin D next because that is very, very much at root cause. But the point is that, again, if you don't know if your cortisol is high or low, then if we're using supplementation, we're more guessing. If your cortisol is high, okay, Michelle, I know. Michelle, this is all I do. This is my clinical practice. This is the people that I work with. every single day. So I just take my cases. I don't name any names, but I just throw this information up here because you guys need to know that, you guys need to understand that there's actually a way out of this. 100%. But you're going to have to change what you're doing. Okay? You will absolutely have to change what you're doing on a daily basis if you want to get out of long haul. Okay? So again, the concern here is not so much, hey, like what antivirals do I take? It's how do we get that cortisol rhythm re-regulated? Again, if you had high levels of cortisol and you do HIIT training, high intensity interval training, that might be the worst thing for you. You may be that person that you don't want to do yoga, but you're probably going to be the best if you did the yoga, especially in the AM, right? If you are low on your cortisol, the best thing for you may actually to do high intensity interval training. Again, one man's, right? One person's poison is another person's potion. So knowing what to do is important. This is why, again, testing is so critical. All right, so again, that's one aspect that needs to be looked at. Also, interestingly enough, right, is that when we talk about cortisol, that directly impacts brain health. We know people that have long-term dysregulation of their circadian cortisol rhythm are at risk for developing neurodegeneration, i.e. Parkinson's, dementia, these issues, okay? Yep, so Spider Moon, yes, I've done thousands of Dutch tests in my career. So yes, and cortisol does affect collagen because cortisol impacts vitamin C, which is critical when it comes to your collagen health, okay? So here, number 3, okay? I think we should, here. Okay, so again, how do we know if you have a cortisol problem? You're waking up feeling beat up. You have to have caffeine or sugar in the AM. You're tanking mid-afternoon, or you're a night owl at nighttime. Especially as well, commonly a strong indication of a cortisol problem is when at nighttime you wake up at the same night. Wake up at the same time. So if you're waking up like every night at 2 a.m., waking up every night at 3 a.m., usually you're burning through your glycogen stores. That means you're surging hormones to get your blood sugar levels up because your blood sugar levels are starting to drop, but then you wake up. And so that obviously that alters your sleep rhythm. So the point is that, again, that's an indication of a cortisol problem, but the number one thing that drives cortisol dysregulation is your blood sugar. Okay, Kristen, yes. Christine, Bara, yes. Adverse childhood experiences and autoimmunity, okay? Okay, no, it's not just God wanting to talk. God always wants to talk to you, not just at 2 a.m., by the way, okay? But again, we're going to talk about essentially insulin resistance. Okay, so again, looking at past people that did the worst through COVID infections, those people that did the worst, the highest level of mortality were in people who had insulin resistance. Those insulin-dependent type 2 diabetics had the highest mortality rate when COVID ran through. Okay? You're welcome, Christine. Yes, ferritin of a 25 is too low. So again, how do we know if we have insulin resistance? Well, if you have long haul, there's a very good chance that you have insulin resistance, but you had insulin resistance going into the COVID infection. Guys, if you had a vaccine and you were never the same, if you had COVID and you were never the same, hey, my smell really sucks. How the hell is that related to blood sugar? Because you were insulin resistant going into the infection, and as a result, you suppressed the ability to regulate inflammation. Those people that are insulin resistant, they don't do a good job of regulating their inflammation. Why do you think people, right, they get vascular changes with type 2 diabetes? They lose limbs. They can't get their immune system into areas, and then so the antibiotics don't work for them. So they amputate. But here's the trick, guys. You can have a within normal limits A1C glucose, because remember, that's a 2-month average. And your blood sugar can still be doing this. Whee! You're shaky, irritable, lightheaded in between meals, or are you going too long between meals? Hypoglycemic. Crashing after a meal. Craving sugar. I crave sugar all the time. I'm like, yes, you're insulin resistant. Jackie, yes, we are. Okay, we'll talk about the cure. Okay. But the point is, right, Christine, ferritin should be above 50 in menstruating females. Okay? Oh my God, please don't talk to me about Ozempic. No, Ozempic is going to make all this worse because you lose muscle mass when you take Ozempic. We know now all that research on Mounjaro and Ozempic, the GLP agonists cause muscle mass loss. Upwards of 30% of the weight loss from GLP agonists is muscle mass. So guess what happens? Muscle mass is what you need to maintain integrity of insulin sensitivity and brain health. You don't have muscle mass, that is one of the highest independent correlated risk factors for developing dementia. So this is the madness behind Ozempic and Mounjaro and them being touted as a weight loss drug. I'm like, what are you losing? Are you losing water mass? Are you losing fat mass? Are you losing muscle mass? How would you know? You would do a bioimpedance analysis. A BIA will tell you what you're losing. If you guys are on these drugs and you're not doing a BIA, what are you losing? You're just assuming that you're losing fat because your weight's coming down. You're looking at the scale and I look better, so I'm going to keep taking the drug. Man, I'm telling you, what you don't know will hurt you. Okay, so here's the deal. You can test for insulin resistance, or again, if you have certain symptoms, you'll know that you have insulin resistance. So again, it's the same thing, right? But everyone so the initial blood panel that I do on my clients, it's a 90 marker comprehensive blood panel. Every single client will get A1C, everyone will get glucose, but everyone needs to have their insulin tested. If you're fasting, your insulin should be under a 5.0. If you're non-fasting, anything above a 25, again, red flag. So the point is that if you are sensitive to insulin, when you consume carbohydrates, you're not going to need a lot of insulin to get that blood sugar inside the cell. If you are insensitive, if you're not sensitive to insulin, you're going to need a higher amount of insulin, which is inflammatory. It also produces fat cells. Fat cells make estrogen. Estrogen causes estrogen dominance. Estrogen feeds into dysbiosis as well. Right? Oof. 60 non-fasting. Yes, that's quite high. Okay, so what do I recommend? What's the action step? Okay, well, yes, it's going to be diet, but really 2, testing, but 3, okay, CGM. Right here, one of these little beauties. Okay, there's different ones out there. So we started with our clients with this. This is the Signos. This is the Dexcom G6. They're making the Dexcom G7. We're not using them anymore because this is easier to use. The app is better. And quite frankly, when it's less expensive and the app is better and it's easier for clients to use, I'm just going to go with that one. So this right here is the Libre 3, and then I use a company called Thea, and so they're the one that basically hooks people up with that. Now they go through me or they go through a provider, but again, sometimes insurances pick this up. This is about like maybe one of the only things that might be covered in functional medicine, but about half the time it isn't. So again, the point is to understand what spikes your blood sugar, what drops your blood sugar, what time of day is it, what did you eat before when you saw those spikes, right? And so again, the whole point of this is that it is Bluetoothing from the transmitter to your smartphone. So you can actually have that data to figure out what's really going on with your blood sugar. But man, if your blood sugar is doing this and this and this, there's no way you're gonna get that back. It's not gonna happen. Because every time you're spiking and you're dropping that blood sugar, you need hormonal fluctuations to regulate that. And that is pro-inflammatory. And that is actually, again, it's damaging to your neurons. Like I said, neurons need glucose, oxygen, stimulation. So again, from the dietary perspective, if you guys want a handout for recipes, you can go into my link tree, you can go to my bio, and we have a 3-day recipe guide for you guys. Okay, you'll see the CGM link is in there too. The diet guide is all the way at the bottom. Okay, but the point is that this right here, so again, insulin resistance, again, according to peer-reviewed research, seems to be a strong predictor for people who are going to become long haul. Okay, so for me, Shay, very good question. What blood sugar ranges should people stay in? About 80 to 120 is actually the range of where we want people to stay. And again, like I said, you can have a 5.2 perfect A1C. Your doctor's like, oh, it's so amazing. Great job. And you're like, but I'm crashing after meals and like I'm craving sugar all the time. And like, woo, if I don't eat, like I need a Snickers bar, you know? And so again, you could be dysglycemic, but your average looks normal because your insulin is so jacked up, holding your blood sugar down. And then when your insulin fails, yes, now you'll start to see elevated A1C. That is a little bit, that's getting behind the 8 ball, right? So yeah, so again, if you're dealing with brain fog, if you're dealing with fatigue, if you're dealing with smell changes, again, these are all long haul changes, but again, really what's going on here is there's autoimmunity going on. Again, autoimmune is genetic predisposition, environmental factors, triggers, and leaky gut. It's just now what we're actually, the game that we're now seeing, and the research that's coming out is saying, hey, it's not just autoimmunity that's starting in the gut. It's, again, we're making autoantibodies against blood-brain barrier proteins, against cerebellar proteins, people that are basically like getting balance-related issues, all, myelin antibody, like all these neurologic structures can become attacked. But in particular, when you actually talk again about the smell changes, that's your temporal lobe. That's related to those short-term memories, right? So when people are like, doo-doo-doo, why did I walk into that room? I'm going to go back to the other room. We'll figure this out. Oh, that's right. I was getting the screwdriver. That, again, is not just a senior moment. That's an indication, that's a glimpse of what your future is going to look like. Do not let people tell you that it's normal to walk into rooms and forget why. Because when you forget that you walked into rooms and you forgot, that's when it's dangerous, right? That's when people start leaving on the stove. That's when people start to, oh man, I forgot that I left the propane on. Oh, whoops. Oh, Grandpa left the stove on again. I'm like, well, until he burns the building down, right? That's not okay. Hey, what's up? We got a new subscriber. That's awesome. So again, the point is these things, right, again, are pushing people in that direction for long haul. Now, I mentioned that there is a rehab therapy out there for people with anosmia, parosmia, and it actually is insulin therapy. So you can literally, if you guys look this up, there's intranasal, right? Intranasal insulin therapy. And I don't typically recommend it right off the bat, but it is something that has been shown in peer-reviewed research that does actually work, and it can improve smell. It can improve other cognitive function, okay? And so again, yes, if you keep your blood sugar between 80 to 120, more than likely insulin will come down. Now, if you have autoimmune, if you have like latent type 1.5, you won't see the insulin drop. But that's going to be confirmed with GAD65 antibodies or insulin antibodies or pancreatic beta cell antibodies. So there's actually 3 antibodies that need to be run if people's insulin levels aren't coming down because, again, they may have type 1.5, which is late onset insulin-dependent diabetes, and it's autoimmune is what it is. Okay, so again, how about tinnitus? Anybody dealing with tinnitus besides smell changes? Again, that's going to also be related to your temporal lobe. Your temporal lobe is where you have sensory information, including hearing. Okay, tinnitus is a sign of neurologic inflammation. Teresa, yes, PR is now being considered autoimmune. It's a seronegative, but that just means that rheumatoid factor is not positive. Okay? So again, back to here, what else is going on? Like, what else drives this? We know that gut dysbiosis, this is where I'm going to say, hey, look, a PCR stool. My recommendation is the GI map. Okay? Looking at Epstein-Barr virus. Again, have you been tested for Epstein-Barr virus? How would you know? There's multiple markers that need to be checked for that. Cortisol is probably the biggest issue when it comes to Epstein-Barr virus reactivation. We know that a high percentage of people with long haul and neurologic symptoms after COVID infections are dealing with EBV reactivation. But again, what seems to really move the needle for people is getting their cortisol rhythm re-regulated. So again, for me, that's going to be the Dutch test. Okay? Because that looks at the actual circadian rhythm throughout the day, not just one marker, not just a blood test, a 1 point, not just a one-off test of cortisol is not a lot of information, right? As well is, again, insulin resistance is a massive factor, which is why diet is so important, which is why exercise is so important. But again, getting inflammation down, getting momentum before we get into exercise is usually how I recommend it. And that usually means, hey, look, initial supplementation, doing some basics. I use something called a starter pack for people, okay? But then also, again, getting into some customization as far as their exercise is important. So as well, here, okay, low how about low glutathione? Okay? Do we all know what glutathione is? Spider moon, very commonly mouth sores. You actually can get actual reactivation of fever with that. There are certain rashes that are associated with herpetic infections. Okay, so this right here, glutathione, okay, is the #1 antioxidant in your body, and it's the #1 detoxification enzyme in your body. All right? So there's 2 critical nutrients associated with this. Cysteine, right, which is an amino acid, and selenium. Did you know that populations with the highest concentration of selenium in their diet suffered the lowest rate of COVID, as shown in Chinese research? Interesting. Yet the Chinese government never gave their population selenium, which sounds kind of crazy because the research was actually sponsored by their government. And one of the research articles that came out fairly soon when COVID hit was that your selenium status also impacts your severity of COVID. But it also happens to be the #1 mineral associated with glutathione status. It recycles your glutathione. So glutathione is the shield, it's the barrier that actually protects your tissue. So when you have inflammation, guess what? You need glutathione. If you don't have enough glutathione, then guess what? Your tissue gets beaten up. When it gets beaten up, it will be tagged by your immune system, and then that can actually instigate and start the autoimmune process. So your levels of glutathione are very important. G. Wali, I don't recommend Brazil nuts for selenium because of topsoil issues. You see a huge flux. So when I did my master's in nutrition, we looked at one of the things of selenium content varying depending on your geographic locale, right? Where you get it from. And there's a huge fluctuation in the amount of selenium, but yes, you can get selenium from Brazil nuts. So again, the point is, right, is that for me, I'm gonna recommend a supplement, probably first over just doing Brazil nuts, even though I'm a huge fan of getting nutrients from foods, but it just kind of depends on what nutrient we're talking about. Again, if we want glutathione, the number one nutrient, right, is gonna be, you're going to find that in something called NAC or NAC. Doesn't matter if they're organic Brazil nuts. Organic doesn't mean anything as far as the soil content. The topsoil, guys, is where we get our nutrients from. Topsoils have been dramatically changed in this world in the past 50 years. So, Kristen, it's your gut. Unless you're having very heavy menstrual cycles, okay? So we're talking very heavy menstrual cycles. Yes, that can cause anemia, but the number one reason why people have chronic anemia, chronically low levels of ferritin, which guess what? Your iron is necessary for your immune system and fighting infections. So chronic infections are another indication potentially of low levels of iron, but that is screaming a gut. NAC is N-acetylcysteine, cysteine, i.e. the amino acid, okay? Yeah, Christine, you got to get your gut fixed, man. There's something going on there. So low glutathione status, again, strongly correlated to long haul and those related issues. And then 5 is hypovitaminosis. D, low levels of vitamin D. In fact, again, there was a research article that was published. I think it was June or July of 22, and it said if you had a vitamin D status of 50 going into COVID, you would not die. That was a again meta-analysis saying, hey, look, if you actually had a normal vitamin D level going into COVID, there's almost zero fatality. So again, are you getting enough vitamin D? How would you know? You would hopefully test. Test where you're at and then figure out what you need, where you want to go. Again, for me, I want people's levels between a 50 to 70. Yeah, Cole, again, you can get in trouble for being too high. But honestly, again, outside of like 150, I've honestly never seen side effects from high levels of vitamin D, but I caution people. I say, yeah, it's a fat-soluble nutrient, A, E, D, and K. So we don't want to go too crazy on your vitamin D levels, but this is also, again, why you test, figure out where it is, therapeutic dosing of vitamin D, come back, repeat, and see where your level's at, see what you need to maintain. The word circled next to EBV reactivation is cortisol. Sorry, it's my handwriting. Cortisol. So cortisol dysregulation is strongly correlated with Epstein-Barr virus reactivation. And yes, user 728, that's all we do. I'm 100% online. And so I had a physical functional medicine practice in Boulder, Colorado for 13 and a half years. And then basically because of COVID, I learned that, well, I can make an online telemedicine practice work. And that's what I've been doing that for about a year and a half. Shay, not necessarily. You keep that in check. So Spider Moon, as far as for a consult, it's a 90 marker panel that I run. Yes, we check your vitamin D. Yes, we do insulin. We don't do some of the fancy tests because we don't want to run those until we really know we want to spend the money on that. But we do an initial 90 marker blood panel. And then it's a 90-minute consult with me, and that's $350. And then at that point, I go through my recommendations. I'll let you know what I see, what hasn't been done, what additional testing you need. And then at that point, I kind of just say, hey, look, here's what we can do, and can I help you? That's kind of one of the questions I'm always asking myself is, do I feel like based on the changes you're willing to make and based on the recommendations that I'm seeing, you know, like, can we actually make a huge change for you? It's a lot more than just a CBC panel. So that's part of it, yes. COMP14, CBC, total, it's a complete anemia panel, 8-marker thyroid panel, complete hormone panel. We run, again, nutrient markers, vitamin D, homocysteine, C-reactive protein, antinuclear antibody with reflex if it's positive. So it's kind of it's the whole 9 yards. Okay? Yeah, well, thank you, Vivian. I appreciate it. So again, raising ferritin if your iron is low is an indication of gastrointestinal dysbiosis and or you might have food sensitivities. So there's about 5 other mechanisms here, guys, that I haven't gone through as far as for root causes behind why people are dealing with long haul. But again, keep in mind that now long haul is being accepted as autoimmune. So one of these things that I haven't mentioned would be gluten sensitivity. So if you've turned on inflammatory process, especially in your gut, and it's manifesting extra-intestinally, right? It doesn't, just because there's an issue here doesn't mean you're going to have gut symptoms. You can have neurologic symptoms as a result of a gut problem. So again, one of the more common triggers is going to be gluten sensitivity. You may not have celiac disease, but you may be reactive to gluten, and that reaction doesn't have to stay in the gut. In fact, again, preferentially, it may be showing up in your brain. It may be showing up as brain fog. It may be showing up as fatigue. It may be showing up as numbness and tingling and these weird symptoms that you're getting. It may show up as tinnitus. So the point, though, is that it's neurologic inflammation. Whatever's causing neurologic inflammation, that is going to push your physiology towards dysfunction. And again, like I was saying, is that every neuron is hooked to potentially thousands of other neurons. So if you get one neuron that dies, that impacts that other 1,000. And then those neurons, if they die, they're connected to other neurons too. Okay? So you can reverse this. You can get out of the vicious cycle behind it. But what I don't see work is like, well, I'm just going to take some zinc and I'm going to take a gut healing probiotic, and I guess we'll just call it good. Like, that's guessing at what's actually causing this. Kim, yes, MS can be related to tinnitus, for sure. Britt Ann, unless you cut gluten, you will never get rid of SIBO. And if you have SIBO, that's probably the mechanism for your anxiety. So again, guys, even if you were tested for celiac disease, does not mean that it's okay to eat gluten. It's not how it works. Okay? Britt Ann, report back to us, okay? But again, what's so often what people don't understand is that, again, the reason I put gut dysbiosis here is because it's so common and it's so commonly left out when people are dealing with long haul issues. So then again, you're like, it's a non-starter. If you don't get your gut handled, you're never going to get a long haul problem handled as well. Again, your immune system is primarily located in your gut. So why wouldn't we want to go to the gut when we have chronic inflammatory issues? It just makes too much sense. The problem is that the pharmaceutical companies can't patent products because you can't patent, yes, you can own a strain of a probiotic, right? But there's no patent on that. So unless it's like somehow new and you can actually patent it, they're not going to make an extreme amount of money on it. This is why they're pursuing the drug model, because when you can patent a medication, right, you can't control vitamin D, even though all of us need it. That's right. Happy gut equals happy life. 100%. That's right. And who said all diseases begin in the gut? There's a very smart human being who said that. Who said all disease begins in the gut? Come on. Me. There you go. Jiwali, you're right. No, not. Yep, it's Hippocrates. There it is. Good job. Yes, yeah, exactly. You're only as healthy as your gut, essentially. Okay. So again, I'll leave you guys with that. Like I said, we have a 3-day dietary guide. Outside of that, I can take a couple more questions here, but you guys can go to Linktree. You guys can go to the bio. Just understand that if you guys are dealing with long haul issues and you're sick and tired of being sick and tired, those are the clients that we work with on a regular basis. We're seeing people who unfortunately again have had damage from vaccines, to those people that again had a COVID infection, were never the same after it. The most important thing is that understand that again, as anosmia, parosmia, these smell changes are not normal. They are indicative of neurologic inflammation. Inflammation in the brain does not typically just fix itself. It is, again, fixing the root cause, and then, yes, making sure that you have the right protocol to upregulate something called brain-derived neurotrophic panel. Oh, my God. Brain-derived neurotrophic factor. Woo! BDNF. So we want to bring up that BDNF, but again, one of the ways of doing that is we got to figure out what's causing inflammation and then get that wrapped in. Okay. Layla Mo, you probably came in early. If you guys want I tell you what, for those guys who've come in late, we have a lot of people here. For those people that came in late, if you want to hear this whole presentation, I'll go ahead and load this up to YouTube on my YouTube channel. And you just need to email info@drautoimmune.com. So if you want to see this whole lecture that I just gave, it's like 75 minutes that I've been going here, then I'd encourage you to email info@drautoimmune.com. I'm going to load up this lecture tonight, and then hopefully by tomorrow we can email you guys. And again, user 98002, does your panel check for gluten sensitivity? I don't do that on the first test. So there's quite a few people who come to me and they're well beyond gluten and they're just not consuming it in their diet. So not everyone gets a gluten sensitivity panel. And so my initial blood panel is just a 90 marker panel. And then when I get into actually explaining what's going on with your labs and talking to you about your timeline and history and all your systems, then we'll start to customize what labs you need. Okay. Otherwise, I just don't want to waste people's money and say, oh, get this, this, and this. And, again, everything costs money. And so I always want to be really efficient with people as far as what testing we're getting. So again, if you guys want that, just go ahead and email info@drautoimmune.com. That's Nancy. She's my new patient coordinator. And she'll get you the link as far as for the YouTube. I'll make sure I'll get that loaded up. You guys can see that. But this is important. It's also important for other people to see this because I know you guys know of people that have not really recovered well from COVID. It'd probably be beneficial if they maybe see this as well. But there are functional medicine ways to really actually get at that inflammation. Like I mentioned, there is intranasal insulin therapy that has been shown. There actually has been some promise around that. There are some peptides out there that are pretty cool. I'm a huge, huge fan of NAD. Nicotinamide adenine dinucleotide. NAD is essentially it's the enzyme that helps you produce energy. Okay, so again, the point is that there's lots of stuff that can be done, but again, looking at what's specifically going on with you may be the most effective strategy. And again, if you guys need help beyond that, please. I do international consults, so technically, no, I'm not in the UK, but I just started care last week actually with someone in the United Kingdom, so we can ship labs to the United Kingdom. We can ship supplements to the UK. A little bit extra as far as a cost on that, but we always tell you what that is before we do it. So Ashley, diet is probably not going to be the only thing that's going to reverse autoimmunity, but it's going to be part of it. So it's always multifactorial. Remember again, autoimmune is genetics, environment, triggers, and leaky gut. So those are 4 things that have to be identified and addressed per the person who has autoimmunity. Okay? And no, NAC is not in matcha. Yep, same thing for Jamaica. We have to figure out how to get labs, and so again, some of these international countries, it gets a little bit more challenging, but if you're international, just reach out to Nancy. Her, again, email is info@drautoimmune.com. I do work with pediatrics, absolutely. I have no criteria. So again, guys, I have 3 criteria as it relates to people being patients, but age is not one of those. So it's, are you willing to change your diet? Are you willing to take supplements? And what is your motivation level from a scale of 1 to 10? Those are the 3 questions that we ask our clients. So anybody, okay. Mahogany, is the first appointment at 20 or 90 minutes? So the first appointment is, again, a discovery call. Okay, Mahogany? But the appointment with me is a 90-minute visit, and that's when we have your blood work back. Okay? Yes, Vivian, so if you had a loss of a spouse and there was very high levels of stress, then yeah, that can cause, again, neurologic issues as well. So any sustained chronic cortisol release, adrenaline, epinephrine, etc., catecholamines, will cause neuronal changes, and the most susceptible tissue to stress is your hippocampus. That's your temporal lobe. That's also where we process smell. Okay? It takes usually less than 2 weeks to get labs back. Okay, guys, again, appreciate everybody here. You guys are amazing. I got to go take care of a sick kiddo. My little daughter came home from school. So we got to go doctor her up, get her taken care of. You guys are amazing. Again, send me any questions you guys have as far as anything else I can do for you. And we will see you again back here on the next live with Dr. Ian, Dr. Autoimmune. And until next time, let your health soar.